I'll be taking it over for the second part of our presentation, and I don't think this is on the slideshow, but essentially Jonathan and I have done a lot of music concerts over the past year because we're heavily involved in music. And so we've done over 30 community outreach performances across 5 cities. And every time we finish, we always talk to the residents and the seniors to see what sort of issues are facing them. And so we can also create a personal connection. In West Vancouver, we have, one of the oldest populations in British Columbia. The median age here is 50, which is almost a decade older than the regional average. And I think we mentioned this earlier, but now 1 in 3 residents, that's 30%, that are over the age of 65 in West Vancouver, and that number is expected to grow even more. In contrast, the entire Vancouver regional seniors population grew from 12% to only 17% over the same period. And so right now, West Vancouver only provides 2 limited capacity walk-in clinics, the Orca and the Ocean clinics, but they only really treat non-urgent cases. And an aging population means we have more falls, more infections, more medical complications, more urgent medical needs. Now, the solution for most West Vancouver residents, particularly seniors, is to go to urgent and primary care centers, or UPCCs. They provide the same day non-emergency medical care. They're designed to treat issues that are urgent, right? They also have like CT scans, they have ultrasounds, they have x-rays, and they reduce pressure on hospital emergency rooms. Right now, the problem is there's only one UPCC serving the entire North Shore, namely the North Vancouver Centre Urgent and Primary Care Centre. So that means residents from West Vancouver, the city of North Vancouver, the district of North Vancouver, Lions Bay, Bowen Island, that's nearly 200,000 people. They all rely on a single urgent care centre in North Vancouver. So you can see why there might be a little bit of a problem there. Wait times are unbearable. It can take 5 to 6 hours just to be seen. So you walk in, you register, you see a nurse, you're given a number, and then you wait hours. And when your turn finally approaches, you get a 15-minute warning. So if you're not back at the clinic within 15 minutes, your spot is canceled. So as a senior, you have 2 choices. You either sit in the waiting room for half a day, or you attempt to travel back to West Vancouver and somehow return through very, very heavy traffic, right, within those 15 minutes time. And Vancouver Coastal Health itself acknowledges that because of high volumes, the North Vancouver UPCC may stop accepting new patients earlier in the day to safely finishing caring for those who are already waiting. So that means even if you already make the trip, your care is not guaranteed. Now, it's easy to say that North Vancouver is only 10 minutes away, but that assumes that you can drive. That assumes that you have no mobility challenges. That assumes that there's no massive traffic jam every single day from West Vancouver to North Vancouver. That assumes you do not live in Horseshoe Bay. That assumes that you do not rely on HandyDART, which is an alternative to conventional public transit that many seniors rely on. But still, HandyDART has many problems. Many seniors with poor eyesight, with cognitive or physical issues, they have problems applying for these services. And even when they do apply, HandyDART must be booked days in advance and does not guarantee availability due to demand. So seniors are put on a wait list. And that doesn't work if they have urgent care. And long wait times, even at the stops, at the bus stops for HandyDARTs, and frequent delays mean that we increase times. A lot of these seniors are very vulnerable that we talk about. When we go to senior residences and we perform with them, or even at the West Vancouver Community Seniors Activity Center, many of them tell us how they only rely on government pensions. They don't have money to travel, about how, a lot of them use the shower service at the West Vancouver Seniors Activity Center because there's no place for them to go. They're homeless. So what we're proposing is an urgent and primary care center built in West Vancouver. This would, reduce pressure on the North Vancouver UPCC. This would reduce avoidable emergency room visits in Lions Gate Hospital. This would shorten wait times. This would improve early intervention for treatable conditions. And this would also reduce congestion and traffic from West Vancouver to North Vancouver, because there's less people going to the North Vancouver Urgent Care Center and the Lions Gate Hospital. But more importantly, we can also make sure that we prevent, we can provide convenient treatments, and this prevents treatable illnesses from developing into more chronic forms of those illnesses, which means we prevent 911 calls. We reduce costs because it's an easier problem to fix. So, our ask is, we understand that healthcare is a provincial jurisdictions, but municipalities are not powerless. We can First, formally request the Vancouver health area a North Shore urgent care capacity review. Second, we can identify and pre-zone potential sites. Third, commit to fast-track approvals. Fourth, demonstrate demographic need with clear data. And fifth, work with the Youth Advocates for Global Health Association as a formal stakeholder to help provide data and run services for these projects free of cost. Healthcare in Canada, is built on accessibility, reasonable access without barriers. When nearly 200,000 people rely on a single urgent care center, when 1 in 3 residents here are seniors, and when mobility is not even guaranteed, that's when accessibility is jeopardized. And look, our seniors really deserve better, and we deserve better. We think West Vancouver should be proactive, not reactive. Thank you very much.
Gentlemen, that was an excellent presentation. Well done. Well done. You'll be happy to know this council is proactive on that subject. We have identified the potential locations, and it's very much something we are working on. Be happy to talk to you about that offline. But gentlemen, very well done. Great presentation. Thank you.
Thank you for inviting us.
Could I ask Councillor Cassidy to formally thank our guests?
Yes, thank you very much. Interesting enough, in an election time period about 10 years ago, one of the candidates specifically addressed the need for such and gave various solutions as far as geographic locations that could be applied to for such a site. So yes, it has been uppermost in a lot of people's minds for quite a while. Yeah, thank you. So I would also like to recommend that the delegation from the Youth Advocates for Global Health Association regarding seniors' health accessibility policy for West Vancouver be received for information with thanks. And thank you very much.
Yeah. Gentlemen, we'll be in touch. Well done.
Okay, thank you very much.
Thank you. Call a question. All in favor? Contrary, carried. Thank you.